Hello, welcome to Vet Talks with Doc Athena. Let's talk about vaccine for dogs. There are core and non-core vaccines for animals. This video is intended as a guide for pet owners, veterinary medicine students, and basically to anyone who is interested in this topic. Canine parvovirus is a very contagious viral disease of dogs, and this is caused by canine parvovirus 2B. This usually infects young puppies, mainly about 6 weeks to 6 months old, and usually the unvaccinated or incompletely vaccinated puppies. While it's true that this is a disease of young animals, adults could also be infected, especially unvaccinated ones. The virus has evolved and there had been mutations over the years. Now, there's also a variant which causes myocarditis in neonatal infection. There are also some reports of higher incidence or risks in some breeds, such as the Rottweilers, Doberman Pinscher, American Pit Bull, German Shepherds, and English Springer Spaniel. This disease is more common as compared to canine distemper, and usually the route of infection is through feco-oral. Why it is very important to vaccinate the dogs against parvovirus? Because this virus is very hardy and resilient, and they stay in the environment for a long period of time, even with the use of disinfectants, okay? That's why vaccination is very important to keep our animals' immune system strong against this virus. So what happens when this disease infects our animals? Well, basically, this virus attacks the intestinal tract and they destroy the intestinal cells called as enterocytes. And when the cells are already destroyed, secondary bacterial infection could happen. And therefore, signs that we could observe is bloody diarrhea. This destruction of the enterocytes causes this distinct parvo smell. Vets who are very familiar with these cases, sometimes they could already diagnose that the case is parvovirus with the mere smell of it. Because as I have mentioned, there is a distinct smell from this disease due to the enterocyte destruction. What are the clinical signs that we could observe in a patient suffering from canine parvovirus infection? Lethargy, lack of appetite, depression. Sometimes there is a sudden onset of fever due to the infection. This is a multisystemic disease, so it might include gastrointestinal tract or GIT, a cardiovascular system, respiratory system, and sometimes the CNS or the central nervous system. That's why the signs would range from vomiting to bloody diarrhea, and there's a cardiovascular shock. So if there's a bloody diarrhea, this could possibly cause hypovolemic shock. And when there's shock, eventually this could lead to death. So how do we diagnose this disease? Well, usually, of course, your vet would ask for the history. With history, is the patient vaccinated against parvovirus? Because as I have mentioned, this is usually a disease of unvaccinated animals. All right. Also, the signalement. Why? What's with the signalement? Signalement is actually the facts or the information about the patient. So such as the age, gender, breed, doesn't matter if it's a male or female, but usually it's young, okay, and also the breed, we have mentioned that, and of course the clinical signs when the animal is brought to the hospital. Sometimes the animal would also produce bloody diarrhea while it is being physically examined by the veterinarian. Speaking of physical examination, there could be tachycardia. What is tachycardia? That is an increase in heart rate. So there could also be pale mucous membranes. Okay, that could be an indication of anemia due to severe blood loss and dehydration as well. There could also be pain or discomfort during the abdominal palpation, and your vet might also mention about an intussusception. Diagnostic techniques that could be employed could be imaging using radiology or X-ray, as well as ultrasound to check or to have a window what's going on inside the animal's abdomen. Nowadays, we have these rapid test kits, okay, or ELISA test kits. Your vet might use this, and also for verification, well, RT-PCR could also be used. Since this is a very dangerous disease, I think the question is, can it be treated? Just like any other viral disease, there is no specific treatment to eliminate the virus. However, what we can do is to boost the immune system of the animal. And we could also utilize the use of heterologous immunoglobulins. This is for the passive immunity of the patient. It's more likely that the patient would survive this infection. Aside from boosting the immune system, supportive treatment could also be implemented. We mentioned about dehydration a while ago because of the bloody diarrhea. There's diarrhea, then we have to replenish the losses or the water loss of the animal through giving fluids. If there's no history of vomiting, we can give oral fluids and electrolytes. Or if there's a history of vomiting, then we could give it through IV. Okay, IV fluids is indicated in that matter or in that case. Your vet might also discuss the use of antiemetics, okay, to address the vomiting of the patient. Antibiotics could also be given. Why? Because I have mentioned once the virus has destroyed the enterocytes, secondary bacterial infection could occur. While it's true that this is a contagious and fatal disease, it could also be treated. And there had been successful reports of recovery in this case. Okay, about I think 3 to 4 days, there had been reports that recovery occurred. How about prevention? Well, of course, this could be prevented through vaccination. It's usually included in the 4-way vaccine that is also used against adenovirus infection and canine distemper infection. All right, so this is usually given, okay, in 3 doses. And we have the first dose is usually at 8 weeks old. And even if it was delayed, then it will be recommended that the 3 doses should still be followed. And after that, booster every year, or it could be after 3 years. It depends on the recommendation of your veterinarian. Okay? So this vaccine is usually given subcutaneously. That's it for parvovirus. Thank you for being with me here at Vet Talks with Doc Athena. I hope you learned something from this simple lecture, and if you did, please hit the like button. Also, if you haven't subscribed yet, please do so. You can reach me at Doc Athena Facebook page. Again, thank you, and I hope to see you again soon. God bless us all. Bye!